I discuss about artificial and natural methods of contraception. What is artificial method? Artificial methods in common use include preventing the sperm from reaching the ovum using condoms, diaphragms, etc., inhibiting ovulation using intrauterine devices, killing the sperm using spermicides, and preventing the sperm from entering the seminal. What is natural method? Natural methods of birth control do not involve medications or devices to prevent pregnancy but rather rely on behavioral practices and are making observations about a woman's body and menstrual cycle. The advantage and disadvantage of artificial and natural methods. Artificial. Advantage. Disadvantage. The birth control pill is a safe, simple, and convenient way to prevent pregnancy. It also has other benefits like reducing acne, making your periods lighter and more regular, and easing menstrual cramps. The woman may feel it's a messy procedure. Extra spermicide is needed if sex takes place more than once. The size needs to be checked after. Natural. Advantage. Disadvantage. They can be used by most couples. They not involve the use of chemicals or physical products. They are not as effective as other methods of contraception. The advantage, disadvantage, and side effects or risk of the following. A. Artificial method. Oral contraceptive. Transdermal patch. Vaginal ring. Subdermal implants. Hormonal injections. Intrauterine device. Chemical barrier. Diaphragms. Cervical cap. Male condoms. Female condoms. Surgical methods. B. Natural methods. Calendar method. Basal body temperature. Cervical mucus method. Symptothermal method. Ovulation detection. Coitus interruptus. A. Artificial method. Oral contraceptives. Menstrual changes: heavier, bleeding, amenorrhea or oligomenorrhea, changes in weight, headaches, dizziness, nausea, and cardiovascular impacts. In addition, women may harbor fears of long-term effects of contraceptive use, such as infertility and childbirth complications. Transdermal patch. Nausea, vomiting, constipation, lightheadedness, dizziness, drowsiness, or headache may occur. Mild irritation, itching, or redness at the application site may also occur. Some of these side effects may decrease after you have been using this medication for a while. Vaginal ring. Heart attack, stroke, blood clots, and liver tumors. In very rare cases, they can lead to death. When you talk with your doctor about birth control, tell them about any medicines you've taken and any health problems you've had. Subdermal implants. Nausea, stomach cramping or bloating, dizziness, headache, breast tenderness, acne, hair loss, weight gain, and vaginal irritation or discharge may occur. Pain, bruising, numbness, inflection, and scarring may occur at the site where the rod is placed. Hormonal injections. Weight gain, headaches, mood swings, breast tenderness, and irregular bleeding. Your periods may become more irregular, heavier, shorter, lighter, or stop altogether. Intrauterine device. Spotting between periods, irregular periods, heavier or longer periods, more or worse cramping during your periods, pain when your uterus put in, and cramping or backaches for a few days after. Chemical barriers. Vaginal burning and irritation from the spermicide, diaphragm. From the spermicide, irritation of the vagina and surrounding skin or an allergic reaction, strong odors or vaginal discharge if the diaphragm is left in too long, an allergic reaction to the material in the diaphragm. This is rare, a higher risk for urinary tract infections UTIs. Cervical cap. From the spermicide, irritation of the vagina and surrounding skin or an allergic reaction, strong odors or vaginal discharge if the cap is left in too long, an allergic reaction to the material in the cap. This is rare, changes in the cervix because of irritation. Male condoms. There are very few risks when using a male condom. Some people may be allergic or sensitive to latex sand, therefore a condom might not be suitable. There are, however, female condoms. They can slip out of place during sex. They can irritate your or your partner's skin. They might make the sensation of sex less intense. They're slightly less effective at preventing pregnancy and STDs than male condoms. Surgical method. Lightheadedness, wheezing, rash, low blood pressure, high temperature fever, liver problems, agitation and confusion. B. Natural methods. Abstinence. When sexual abstinence is involuntary, some individuals may feel negative effects on their mental health. Calendar method. The calendar method helps you fertile days by tracking the length of your menstrual cycles over several months to create a fertility calendar. Basal body temperature. Tracking your basal body temperature for either fertility or contraception is inexpensive and doesn't have any side effect. Cervical mucus method. Using the cervical mucus method to promote fertility doesn't pose any risks. Symptothermal method. Particularly in combination with other medications and tobacco and health complications including mood changes, acne, headaches, breast tenderness, pelvic pain, excessive bleeding, amenorrhea, nausea, weight gain and uncommonly, blood clots. Ovulation test. Typical of ovulation symptoms could include cramps, an increase in cervical mucus, breast tenderness, fluid retention and appetite for mood changes. Coitus interrupts. Withdrawal method to prevent pregnancy doesn't pose any direct risks, but it doesn't offer protection from sexual transmitted infections. Some couples also feel that withdrawal method disrupts sexual pleasure.